Move on to question 23. Call on the Honourable Member for Douglas South, Mrs Christian.
Thank you, Mr President. I'd like to ask the Minister for Health and Social Care how patients suffering from long COVID are supported by Manx Care, and what will differentiate the clinical approach applied to the respective patient groups within the planned pathways for long COVID and ME and chronic fatigue syndrome. Thank you, Mr President.
Minister of Health and Social Care to reply.
Thank you, Mr President. Currently, Manx Care offers a long COVID service, which is delivered by 2 senior therapists working from the Community Adult Therapy Service. There are currently 6 patients on their long COVID caseload, with 3 on the waiting list. At the first consultation, clinicians use the COVID-19 Yorkshire Rehab screening tool to ask patients who are referred into the service to score themselves from 0 to 10 on a range of symptoms of long COVID, which include breathing, voice, swallowing, mobility, fatigue, pain, anxiety and depression. Based on the responses provided by the patient on the screening tool, a problem list is developed in conjunction with the patient that attempts to address the areas that are worst affected. A lot of these identified issues requiring attention can be managed by the therapy team, for example, fatigue management, mobility issues. However, other issues, such as ongoing breathing problems and swallowing, will need a referral to a specialist for further investigation and management. Although the long COVID service is small currently, the outcome of a business case submission is awaited that will expand the service significantly, with dedicated clinicians working with ME and CFS and long COVID patients, including a respiratory nurse, a physiotherapist, occupational therapist and a dietitian. A consultant clinical psychologist will also be part of the core team to help patients with the ME, CFS and long COVID service. The service will use a multidisciplinary team approach, which will involve both core team members plus invited members such as consultants and other specialists who can provide input on specific organ problems, for example, consultants in respiratory medicine and cardiology. Detailed clinical pathway design will be written in accordance with the recently published NICE guidelines on both long COVID and ME CFS management. It's worth noting, as I did earlier, that long COVID and ME CFS are not interchangeable terms. Whilst there are overlaps in presentation of some symptoms between the conditions, there are also a number of differences, and this will form an important factor in treatment pathways. It is Manx Care's intention to offer as much therapy as possible transdiagnostically, i.e. covering a number of long-term conditions, not just ME, CFS and long COVID. This could include conditions like Parkinson's, MS and chronic pain, as many therapeutic techniques are applicable and evidence-based across multiple conditions.
Supplementary, Mrs Christian.
Thank you, Mr President. The answer you gave in December's Tynwald indicated that no meaningful improvements have been made to the clinical pathways for post-viral healthcare since the onset of the pandemic. Are there going to be more specific and measurable targets for Manx Care with regards to pathways for both long COVID and ME and CFS syndrome? Thank you, Mr President.
Minister to reply.
Thank you, Mr President. I didn't catch the first part of that question, but I did hear a bit about targets. In terms of measuring Manx Care's response and delivery of the ME-CFS pathway, Objective 1 inside the new mandate actually very specifically specifies a requirement on Manx Care to complete the implementation of a post-COVID-19 syndrome pathway, which means it will be monitored and measured by the Department as part of our mandate assurance process.
Supplementary, Lauder.
I hope the Minister won't mind. I didn't pick this up last time, but it seems relevant here. He mentioned that there are 2 staff within CATS. There are 6 patients. If 2 staff are dealing with 6 patients, how on earth do we have 3 on a waiting list? They must spend an awful lot of time with each patient.
Minister to reply.
Thank you, Mr President. Partly it's due to the resources available for staff to deliver per patient, but my understanding is those 3 patients on the waiting list will be offered appointments in the next week.
Supplementary, Mrs Christian.
Could the Minister provide honourable members that the promise, I like promises too, Dr Hayward, that the promised ME-CFS training sessions for GP planned for March 2022, will they cover long COVID also? And if not, when will this happen? And if so, who will be facilitating the long COVID training? Also, what training has been given and provided to staff at the hospital and other Manx Care facilities regarding long COVID? Thank you, Mr President.
Minister to reply.
Thank you, Mr President. Again, I didn't quite catch the last part of that question. If the member could repeat that, that would be helpful.
Also, what training has been provided to staff at the hospital and other Manx Care facilities regarding long COVID?
Minister to reply.
Thank you very much, Mr. President. In terms of the GP training that's going ahead, my understanding is yes, it will include a combination of training around ME/CFS and long COVID. Again, where the services interrelate, obviously, not with the more broader issues around long COVID, which is slightly different, as has already been covered. In terms of broader training, I'm not really sure how to answer that question because, again, long COVID would present differently depending on different pathways. Clinicians are obviously capable of dealing with their own specialties quite well, and obviously making sure they are up to date in terms of their own professional responsibilities and training. The focus, I think, for Manx Care is ensuring that GPs have appropriate referral and guidance documents and appropriate support so that they can diagnose quickly and refer into the long COVID pathway or the ME/CFS pathway at an earlier stage than would currently be happening. So really the focus at the moment is on GPs and on the long COVID service itself. If there is a need to roll out wider guidance and training, I'm sure Manx Care will undertake that.